When the kid was born 1.5 months early, the mother believed he was fine, but the professionals quickly took him to the neonatal critical care unit. Berku Gökdeniz would not see her child alive again. When Umut Ali's health suddenly declined, the attending physician informed her that his heart had stopped. The 32-year-old e-commerce expert told the Associated Press that the worst moment of her life was witnessing her kid covered in a shroud 10 days after his birth. Since Turkish prosecutors accused 47 doctors, nurses, ambulance drivers, and other medical professionals of negligence or malpractice in the deaths of 10 newborns since last year, Gökdeniz is one of hundreds of parents who have come forward to request an investigation into the deaths of their children or other loved ones. The medical professionals claim they made the best decisions possible while tending to the most vulnerable patients, and they might be prosecuted for any unintended consequences. In October, protesters conducted demonstrations outside hospitals where some of the deaths happened, throwing stones at the buildings. Disappointed parents say they no longer trust the system as a result of the events. The claimed income of the accused has not been disclosed by the prosecution. According to the state-run Anadolu agency, at least 350 families petitioned the president's office, the health ministry, or prosecutors after the scandal broke, asking for an investigation into their loved ones' deaths. The case of the prosecution. The primary defendant, Dr. Ferhat Sarı, who oversaw the newborn intensive care units at multiple Istanbul hospitals, faces a maximum sentence of 583 years in prison, according to the prosecution. Sarı faces charges including homicide by negligence, frauding public institutions, forging official documents, and establishing an organization with the aim of committing a crime. The evidence, according to the prosecution, unequivocally demonstrates medical deception for financial gain. This month, the defendants were charged in an indictment with fabricating documents and putting patients in some private hospitals, neonatal care units for protracted, sometimes needless treatments in settings that weren't equipped to handle them. All Turkish citizens are guaranteed access to healthcare, and private hospitals that treat qualified patients are compensated by the country's public health system. The ruling party of President Recep Tayyip Erdoğan, who has held office since 2002, has advocated for the growth of private healthcare institutions in order to increase access for the 85 million people living in the nation. Death after years without a family. In 2019, Ozan Eskici and his spouse welcomed twins, a girl and a boy, to one of Sarı's hospitals following years of fertility treatment. Both babies were admitted to intensive care, despite their first appearance of health. The son passed away 24 days later, while the girl was released after 11 days. According to a 1,400-page indictment, Sarı disputed during prosecutors' interrogation that his personnel had the necessary qualifications, that the newborn facilities were understaffed, or that the babies were not provided the correct care. Everything is in accordance with procedures, he said to the prosecutors. The indictment, which included hundreds of pages of transcripts of covertly recorded phone conversations between suspects, was authorized by an Istanbul court this week, and the trial date was set for November 18. The defendants are feeling more and more alone as a result of how the case has appalled the country. According to lawyer Ali Karaoglan, he and two other lawyers who defended Sarı throughout the investigation have since left the case. 9 of the 19 hospitals involved in the scam, including one owned by a former health minister, have now had their licenses withdrawn and closed by authorities. Özgür Özel, the leader of the main opposition party, has called for the state to seize and nationalize all of the participating hospitals as a result of the scandal. Erdoğan promised harsh punishment for anyone who caused the fatalities, but he cautioned against blaming the nation's healthcare system exclusively. Erdoğan referred to the suspected offenders as a gang of people devoid of humanity, and declared, "We will not allow our health care community to be battered because of a few rotten apples." This gang committed such heinous crimes by abusing the resources our government provided to guarantee citizens better, more affordable, and easily accessible healthcare, Erdoğan stated. He went on to say, "Those who engage in such savagery will face the worst punishment possible for their offenses. In my capacity as president, I will keep an eye on this matter personally to make sure that these murderers, who preyed on the lives of defenseless infants in order to profit, never again come to light." No longer having faith in the system. Gökdeniz, who gave birth in 2020, claimed that up until she saw the story play out on social media and in TV news, she trusted Sarı and regarded her son's death as normal. She claimed that everything began to fall into place like dominoes. Eskici had also put all his faith in Sari, whose promises he now considers to be cruel lies. He remarked, "I can still see the sentences he told me as if they were yesterday." Sibel Kosel is likewise looking for answers after losing her infant daughter Zeynep in a private hospital in 2017. She claims that the incident has destroyed her faith in the medical establishment and left her constantly worried about her children who are still alive. She declared, "They have destroyed a mother and a father." Kosel begged the authorities to act right away. She pleaded, "Don't let mothers cry, don't let babies die. We want a safe and livable world for our kids."